My name is Gavin Giovannoni. I'm Professor of Neurology at Barts and the London School of Medicine and Dentistry. I spend most of my time researching or managing people with multiple sclerosis, and I'm passionate about trying to improve the outcomes of people with the disease and hopefully in my lifetime prevent or cure the disease. The MS Academy is a unique form of medical education. Our main aim is to upskill healthcare professionals working in the field of multiple sclerosis so they can adopt innovations as quickly as possible for the best outcomes for their patients. So the MS Academy really brings together a group of people, and they sign up by, first of all, sending us their educational needs. We review the educational needs and design a program, and we then match MS experts across the country to tackle the needs. The lectures are not didactic in the sense that it's just information. We try and engage the delegates by giving out case presentations and asking them how to tackle the problems. So it's a very proactive program to engage, and we're hoping in addition to that over time the MS Academy will grow and form a membership, and it's like a support organisation to help improve the services and the way we deliver care to people with multiple sclerosis. So in the Academy we try to approach MS holistically. So it's not only about the treatment of the relapsing phase of the disease with disease-modifying treatments. We also go through the diagnostic phase, looking at MS mimics, even undiagnosing multiple sclerosis. We look at issues around patient activation, what we can do to improve the services we provide to people. And we also focus on symptomatic treatments, problems with bladder, bowel dysfunction, mood, fatigue. And a big component of this is looking at not only the role of neurologists in managing disease, but also the other healthcare professionals, particularly the nurse specialists and our pharmacists in relation to pharmacovigilance. So I think people coming on the Academy must not just view this from a neurology or medical perspective. We try and approach the disease holistically, and we even bring people with the disease on the course to give us their personal experiences about how they interact with healthcare professionals and what they would like to see in the MS services they engage with. I think it shouldn't be viewed as a training course just for MS experts, because there's too many people with MS out there and too much service requirements to specialize, to focus just on specialists. So we would like nurse specialists to come along, also general neurologists who have a specialist interest, as well as associate specialists who help deliver services for people with multiple sclerosis. The MS Academy is very different to other learning courses in that it's much more case-based focused. It's bringing MS experts to give them a hands-on experience with how we manage MS in the contemporary environment, which is becoming more complex. And then we also have a mentorship scheme, so every single delegate will be allocated a mentor to help them in terms of their day-to-day practice with multiple sclerosis. This may be to guide them in setting up MS services, help them with difficult cases, and just give them the confidence to manage multiple sclerosis using the modern drugs in particular. And so we will all allocate each delegate who comes on the course a particular audit to do, and the audit is for them to engage with their local trusts and their local commissioners to tackle a particular problem in relation to people with multiple sclerosis, and then hopefully set up a service or adapt their service to deal with the issue, and then hopefully repeat the audit to show that their intervention has made a difference. The audits we're going to be putting out are quite varied. They may relate to initiation of disease-modifying therapy, relate to the use of MRI and monitoring the condition, and also focusing on the symptomatic problems. One of the big issues we have in the NHS is unplanned or unscheduled hospital admissions in people with multiple sclerosis. These usually relate to urinary tract infections or septicemia, aspiration pneumonia, falls, fractures, chronic constipation, and even relapses. And they consume an enormous amount of healthcare resource, and a lot of these are preventable. So we're trying to activate people on the course to tackle these problems, to try and reduce healthcare expenditure in their regions and then improve the quality of life of people with multiple sclerosis.